people living with a range of inflammatory disorders are at a higher risk of developing shingles, a virus related to chickenpox that causes pain and a blistering rash, than the general population. In fact, people with rheumatoid arthritis, RA, have roughly twice the risk of healthy older adults of developing shingles, reports the Arthritis Foundation, AF. Many people living with inflammatory disorders take tumor necrosis factor inhibitors, TNFs, a class of biological medicines used to block inflammatory processes, but they can lead to immunosuppression, thereby raising the risk of shingles. Fortunately, a safe and effective treatment for this at-risk group may have been discovered. A randomized controlled trial found that the live shingles, or varicella-zoster, vaccine was safe and showed short-term efficacy for participants also taking TNFs. These findings suggest that a live virus vaccine in immunosuppressed patients receiving biologic therapies may be a viable option, especially for the zoster vaccine, if no alternative vaccine is available. The findings are published in Annals of Internal Medicine. Pfizer vaccine side effects: 6 cases of shingles reported in latest research. Prior to this study, the safety and effectiveness of live virus vaccines was largely unknown in this patient population. Researchers from the University of Alabama at Birmingham, UAB, and Oregon Health Sciences University, OHSU, randomly assigned 617 participants receiving TNFs to either the live varicella-zoster vaccine or placebo to determine its safety and efficacy for preventing shingles in these immunocompromised patients. Among those studied, the most common conditions were rheumatoid arthritis and psoriatic arthritis. TNF medications taken were adalimumab, infliximab, etanercept, golimumab, and certolizumab, and concomitant therapies included methotrexate and oral glucocorticoids. Through 6 weeks of observation, there were no cases of vaccine-associated shingles or varicella infection, and the vaccine was well tolerated. Hypertension, a daily dietary fix that can lower BP, advice. Parkinson's, 2 lifestyle behaviors that raise risk, tips. Pancreatic cancer, 2 signs when going to the toilet, advice. The authors noted that responses were variable and not sustained at 1 year after vaccination, suggesting that patients may need to be evaluated for a booster vaccination. The authors concluded the live varicella-zoster vaccine may be considered for those using TNFs, particularly in healthcare settings where no alternative zoster vaccine is available. Shingles. Signs to spot the first signs of shingles can be a tingling or painful feeling in an area of skin, a headache, or feeling generally unwell. According to the NHS, a rash will appear a few days later. Usually you get the shingles rash on your chest and tummy, but it can appear anywhere on your body including on your face, eyes and genitals, explains the health body. It continues, the rash appears as blotches on your skin, on one side of your body only. A rash on both the left and right of your body is unlikely to be shingles. Treatment. According to the Centers for Disease Control and Prevention, CDC, several antiviral medicines, acyclovir, valacyclovir, and famciclovir, are available to treat shingles and shorten the length and severity of the illness. These medicines are most effective if you start taking them as soon as possible after the rash appears, notes the CDC. If you think you have shingles, contact your healthcare provider as soon as possible to discuss treatment. There are also a number of lifestyle and home remedies for immediate relief. Taking a cool bath or using cool, wet compresses on your blisters may help relieve the itching and pain, explains the Mayo Clinic. And, if possible, try to reduce the amount of stress in your life.